All right, here we are. Hi, everyone. Thanks for joining in tonight. Kind of an exciting topic for Dr. Chris and I to talk about tonight. But first, before we jump into the details of it, I wanted to introduce Dr. Chris Hannasch. He is the newest addition to the Michigan Center of Regenerative Medicine family. He is based primarily out of our Grand Rapids location, but does float between the offices for now. And I guess I'll let you talk a little bit about your background, what brought you to us. How did this whole thing fulminate? Because it's been a great journey.
It has been. So, no, I appreciate it. Happy to join the team. So, about the last 15 years or so, I've been affiliated with Michigan State University's Osteopathic Manipulative Medicine Clinic. I was a clinic director there before I decided to jump on board here, but doing a lot of hands-on kind of neuromusculoskeletal medicine and osteopathic manipulative treatment. So, always been a big believer in kind of helping the body heal itself. And, but I knew there was always a limitation to when certain things, maybe certain injuries that I couldn't help that maybe required surgery, and there had to be other alternatives. So when I started seeking out what else was out there and hearing about regenerative medicine and orthobiologics, kind of really looking at, all right, who's doing this the right way and who's been doing it the best. And that's where I came across Michigan Center for Regenerative Medicine.
So we appreciate that. And it's been a joy kind of getting to know you over the couple of years that we've been working together now and getting to this point in your career and joining our team as a clinical provider that's able to offer orthobiologics in addition to those osteopathic skills. Not everybody, I would say, knows what osteopathic manual manipulation, neuromuscular manual manipulation is.
Sure.
You can talk a little bit about that because it really is at the core of what we think about when it comes to regenerative medicine, the whole functional unit, treating things like a total unit rather than a singular structure.
Right. Absolutely. Yeah, it is. I couldn't think of a more seamless transition into the orthobiologic world. But yeah, we very much believe in the philosophy that, mind, body, spirit, with the body healing itself, but also the structure, the body's structure and how it functions are interrelated. We have a lot of, by keeping things aligned correctly and moving and operating how they're supposed to is going to affect how our body functions and vice versa. So doing that through a lot of manual techniques and getting the body through, like I said, gentle manipulative adjustments that don't involve needles, knives, medication, and that stuff, to just optimize our function and an overall health and wellness. And you combine that obviously with a lot of other things in diet, nutrition, and home exercise program to help maintain. But again, that next step when there are things that are a little more permanent that would otherwise require surgery, now we got some other holistic options to improve that with PRP and stem cell, which has been fantastic.
Yep. And then taking that passion and combining it with another passion that both of us share in the sport of golf.
Yeah.
There's a lot of moving parts in the golf swing, and having a great understanding of anatomy, having a great physical exam skills, which is, if I can compliment you on anything tonight, it's you probably have the best physical exam skills of anybody I've had the pleasure of working with. So I really appreciate when you can put your hands on patients and examine. There's a twist here, there's a laxity there,
sure.
And then using your orthobiologic skills now to treat those laxities, to put things back into balance. And now you have an additional training in this Titleist Performance Institute, which is a new training that Titleist has come out with to really dissect down the golf swing, looking for mechanical problems within that golf swing that can be addressed exercise-wise with your golf instructor, looking at your golf swing-wise, but also with your physician. If there's structural abnormalities that you just can't get through because of, you name it, a rotator cuff tear, a knee issue, a meniscus tear, osteoarthritis, is there something we can do from an orthobiologic standpoint that's non-surgical that can help restore your golf swing? So I think I'd love to hear, and I think a lot of us would love to hear more about this Titleist Performance Institute training that you did, what's involved, and how it really meshes your two new skills with manual manipulation and orthobiologics.
Sure. Yeah, great. I love trying to condense so much fun information. But golf and medicine, tough topics to talk about, something we both love. So how I stumbled across this was very similar to, like I said, how I kind of found you guys. But I'm like, I love medicine, love golf, how can I combine this, and started doing a little research and came across Titleist Performance Institute, or TPI. And it's like, these guys are doing it the right way and they're doing it the best. It's been around for years and years. Started by Dr. Greg Rose and Dave Phillips. These guys have been just golf junkies, been in the industry for years and years. And what I like is they've got the data, the numbers to back it up. And they've been collecting data for, like I said, decades now, from PGA Tour pros to the weekend warriors to amateurs alike, and to then now use this data and try and fix as many people as they can. It's been difficult. So it's like, man, there's such a need for it. So in order to be able to get to the masses, he's like, I got to create a training program to help train other people to help me get this out. And so it's really been a fun track. They start out with what's called a TPI level 1, where they introduce a lot of the golf basics to get everybody on. And then from there, you can take different tracks. So the medical track, which is kind of what I went down to get a deeper dive. And they have a golf track if you want to be like a golf coach, a power, a fitness, and whatnot. And so, but the interesting stuff is really that initial TPI philosophy. And it's kind of, their overall philosophy is there's no one way to swing a golf club. There's an infinite number of ways to swing a golf club, but there is one most efficient way to swing that golf club for each person, and it's based on what your body can do physically. So it kind of created like a 15-point efficient screen to just physically see what people can do in their golf swing, and then kind of how that translates. And they teach you, kind of the main golf characteristics that all of us see and whatnot. So some of when you think about this golf swing, there's no one way to do it. I mean, gosh, the world number 1 right now, Scotty Scheffler, right? If you look at his golf swing, or a Jim Furyk for some of the people who've been around a little longer, not your prototypical golf swing, but they still get it done. And it's there's a lot of variables and, like I said, numbers that can back up how they were able to do that and how to make it more efficient. So pretty cool process. But so kind of when you take people through this screen, when you see them, hey, I want to improve my golf game. All right, let's see what your body can do physically. And it's a bunch of, like I said, when done efficiently, maybe take 7-8 minutes. And it's all the different body motions and components you could think that would encompass a golf swing. They're looking at different wrist things, elbow things, shoulder motion, what your torso doing, what you can do with your pelvis and trunk. And then when we take you out and kind of look at your golf swing, it may translate to, okay, why are they doing certain things? So, for example, someone, when you're testing them out, they don't have a whole lot of internal rotation in their right hip. Okay, if they can't go into that backswing and internally rotate, well, they can't get that club back, so maybe that'll lead to a sway, and they kind of sway in their golf swing. And if you don't have a whole lot of external rotation, then okay, how do I get my golf club up if I can't actually rotate? So they might do what's called the chicken wing, kind of get up there with the chicken wing, and it helps them bring that club back a little further. And a lot of pros do this. You may have heard of that. Jack Nicklaus, decent golfer. He was a chicken wing, or excuse me, not chicken wing, flying elbow. All these characteristics I'm getting messed up, but flying elbow, these guys, because if you can't, Fred Couples was another one. Well, number 1, he kind of had this flying elbow to help him create that momentum. So there's ways you can get around this. And again, no one way to do it, but why they were doing it, how they were able to create their force and to still make it an efficient golf swing is kind of what you really get into. So I guess when you kind of ask the questions of what are they doing, how are they doing, and why they do it, I think a lot of ways to assess what you're doing. The easy thing to do is nowadays with cameras, just look at somebody's golf swing, Right. So I think going to a golf pro, you can do it yourself, but really go to someone who's trained, go to a golf pro, man, watch yourself swing. You're going to see, and they'll be able to at least recognize some of these characteristics. When you really match that up with someone who knows this screen, look at why you're maybe doing what you're doing. I guess there's kind of 2 things to think about when you identify a limitation or a problem in how your body moves. And it's going to be 1, either develop a golf swing around that limitation, or 2, how can I improve or fix that limitation?
Right.
And that's usually where most golfers who are golf nuts I want to improve, So that's where you seek out your medical or fitness professional to see, hey, is this something I can improve on? Is that lack of external rotation in my shoulder, hip mobility? Is this just a soft tissue muscle tightness thing that maybe with therapy and stretch exercise I can work out? You have to go to a medical professional and you come to find out, actually, hey, is it osteoarthritis that's limiting me? A cam lesion, something, different deformities, labral tears that may be inhibiting them from not in order to do that. So if you're asking them to do something in their golf swing that they can't physically do, all right. And so what are the workarounds? What are things we can do? And some of those injuries, again, you can work with, maybe a PT and work some about. Some, if it's more permanent, either, hey, I can't load into that right hip with an internal rotation. So, okay, if you don't want to do anything, the golf instructor, hey, I just externally rotate that foot in your backswing and allow you to get a little more. Okay, that's a workaround versus, hey, I want to fix this. And if it is something like an osteoarthritis or a labral tear that's limiting it, that's where, the medical field and our kind of comes in.
Yeah, talk about a little bit of that team. Some of the other, besides medical professionals, doctors make up a very, very small percentage of the people that have done this TPI training.
Very true. I think I was the only one at my training course.
Most are going to be
95% physical therapists, at least in the medical realm I went. The medical realm was 95% physical therapists, a couple chiropractors, and then I think I was about the only physician. Just because practice setup, I don't have the time and the resources, at least in my current practice setup, to take the time to do a lot of these rehab exercises. And because some of it involves a lot of retraining. If we find out, hey, this is something, sometimes there's a whole concept we could get into about, stability versus mobility. And if it's taking some retraining, not only is there retraining tools we're going to use, but so I think the physical therapist that trying to help you learn to move a certain way. To do that. Then if you get out there and, like I said, we recognize with working with your golf professional, if there's certain things like, man, I didn't identify any limitations on your screen, but you're kind of doing a slide. Why are you sliding? Maybe it's just a mechanical issue. And that's where you can work with the golf guy. Maybe you need some improvements in your golf swing. You're not doing it the correct way. As opposed to, okay, is there some sort of inhibition or weakness going on that's forcing me to slide there? So work with the therapist.
Would you say most patients or most golfers are going to have a pain issue that's blocking their ability to swing properly? That would be necessary to see you as someone who could address that pain issue, or does a lot of these conditions occur even without pain?
Got to say it's both. Going to be hard to say. You're right. Some of them it's going to come in because of a pain issue, but I think a lot of it is, like you said, just mobility. When you get into that deeper dive medical course, a lot of it is, you're right, if the TPI screen is actually a very upper level screen. You come in and if someone has pain, you go through what's called the selective functional movement assessment, so SFMA, and you take them through this and to try and delineate what's a functional versus dysfunctional and a painful versus non-painful pattern. So, and then you go to an FMS screen after that before you get to the TPI screen, but a lot of it is mobility.
Yeah, because that's what when we had this conversation, we just randomly kind of ad hoc in the hallway.
We
decided, this would be a great podcast or a great webinar. That's one thing that struck me is that I would say most golfers that see me, most athletes that see me, it's pain that drives them.
Right.
But it doesn't have to be pain. A
Right.
lot of times these, what was the word you used, but these mobility,
like
restrictions or the
these mobility versus stability issues. Like if you kind of break down the body, if you think about it, a weird way to look at it, I think this is our conversation we had is starting at your ankle, right? Your ankle is a very mobile joint in all planes. Above it is a knee that's mostly one plane, right? Flexion extension. It's got a little bit of side to side, a little bit of rotation, but it's most. So you have a very mobile joint ankle with a fairly stable knee joint. Hip, very mobile joint. And then they talk about pelvis. The same thing with the wrist, very mobile. Elbow, mostly a stable joint, doesn't have a lot of side-to-side mobility. It's mostly flexion extension. Then you have a shoulder, very mobile. So you have these alternating patterns throughout your body of mobility and stability. And if you lose stability in you have an ankle fusion, so your ankle doesn't move very well, it's going to try and gain that movement somewhere. It's going to take a stable joint like the knee, and it's going to start moving, maybe it'll relax, try and create mobility so you can do the things you're trying to do in a golf swing. And so different laxities, and that's going to lead to strains and injuries. And that's, again, where we come in as not only maybe from a form standpoint with the golf pro, but the medical professional to try and fix some of that stuff.
Yep. And that's where, again, getting back to where we started, your skill set, starting with your osteopathic manipulation training, and the fact that you were an instructing trainer at Michigan State, is it the biggest program in the United States, or one
for that residency program?
Yeah.
It's the biggest in the U.S. Yeah.
And now taking it a step further, being able to use orthobiologics for stabilizing structures that you just couldn't get with exercise.
Right.
Third step, your brain with the golf swing. I see this as an extremely winning combination for a lot of people out there who are struggling with their swing. As we age, our swing changes, and be able to analyze it, make strategic decisions on where you want to spend your efforts to improve that swing.
Right.
I just think you got a lot of tools in your toolbox that's going to help a lot of people. So
Yeah.
I think this was a great talk.
Yeah, I appreciate it. I look forward to being able to delve into this more. And like I said, as a golf junkie, I like getting into the certain golf swings and the most typical, a lot of the classic amateur golf where, hey, I'm over the top and trying to figure out, and those are the people who come what we call, outside in and have this big old slice. And it's like, okay, why are you doing that? And then when they do that, in order to compensate, then we do what's called early extend, which the amount of back pain, which is of all the injuries people think about in golf at the amateur level, even more than pro golfer, low back's number one. There's a lot of different research, but when you TPI, when they look at the thousands as far as which ones, back is number one, and then it's actually more of the hips, shoulders, knees before you get to all the little ones. Pros, it can be maybe some of the smaller ones because of chronic overuse injuries, but back is definitely number one, and one of the biggest things for that is that early extension in the golf swing again. So again, trying to figure out why, and that can lead to disc herniations, facet syndrome stuff, and so yeah, getting down the medical route was a lot of fun, but then unfortunately those injuries land people here and compensation patterns to go. So there's a lot of unwinding to do, but to keep people healthy in order for them to play golf as long as possible, as well as possible, that's what golf people are looking for, what they're willing to do. They want to be able to play.
And we're doing this talk at the end of January, or mid-January, almost February, right?
Yeah.
There's a reason for that, though.
Yeah.
Orthobiologics, great options for treating those conditions, but they take time.
Yes.
Pain management procedures, cortisone injections, oftentimes help people get through the golf season. And then come the off season is really the time to really work on those weaknesses, those weak points, giving your body that 3 to 6 month window to really get the maximum benefits from your orthobiologic. So we thought it'd be a great time early winter, midwinter, to get this talk out there, get this information out there. We definitely have left some time for questions. So I don't know if you had any last comments that you want to make, other ideas you had. I'm happy to field questions because I'll keep talking about, I'll get dived into the golf nerd stuff all night long if I can. So we don't have any specific questions coming up yet. We definitely have people that are interested, excited about spring coming with golf. But if you have any specific questions you wanted to fire away, we can answer them offline as well. Reply via email. And last word, I will say, just closing comments. Yeah, to help you guys. So website to help you to, hey, how do I get started in this? Where do I go? What do I do? So mytpi.com. Okay, that's, I think, the easiest way to get there. And under the menu, there's a find an expert, and you can just click in and you can put in your area. You can write Rochester Hills and put a radius, and then it allows you to choose, hey, are you looking for a golf expert? Are you looking for a medical expert? Are you looking for a fitness expert? You can choose. And again, what people will show, a lot of people have gone through the level 1 screen, which means they should know how to take you through some of the screening process that I kind of emphasized tonight. Some of the more people, like I said, you see other certifications, whether they went through the medical, the fitness, the power, you can kind of pick and choose what you're looking for. But I think having a good, if you're really wanting to get serious about this and improve your game, and so get better and stay healthy doing it, I think working with a TPI certified golf instructor who understands this, ain't going to try and throw Adam Scott up on the screen and say, hey, I want you to do these things. You might not all be able to move like him, and there may be reasons why. So they're not trying to fit you into a one-stop shop, but they can put you through a screen, figure out why you might be moving a certain way and doing what you're doing, and then figure out, all right, let me send you to a TPI, or you can find your own certified physical therapist who understands and can either work at delineating, hey, is this something you can do and we just need to retrain it, or you can't do and we need to figure out a workaround, or hey, go see, get these treated by this medical professional. So it really is a team approach, team effort, but we want you at your best. We know how many people love golf. We want you to be able to play golf as long as possible, as best as possible. And so, yeah, mytpa.com is a very good resource to kind of look in and find these experts in this field who have a little more understanding of this golf background to help you out. Awesome. Yeah. And then if you want to get an appointment with Dr. Hannasch, Michigan Center of Regenerative Medicine, 248-216-1008. If you're phone call or through our website, regenerativeMedicineMichigan.com. I think this was really awesome. I think I need to schedule an appointment with you.
I wish we could go longer. I'm not
older. It's just
schedule
I
long.
think it's going to be a problem for me next year.
Yeah.
All right.
Fun.
All right. Appreciate it. Thanks for taking the time, sharing your knowledge, your passion. Again, thanks everyone for tuning in. I think we got the website again. We got questions coming out there. In addition to analytics, do you treat conditions with PRP, etc.? Absolutely. We do lots of PRP.
Yeah.
We have some separate webinars on that for different indications, PRP versus stem cells. Happy to field those questions as well if you want to schedule an appointment with.
Most common golf injury by far are strains and sprains. So soft tissue, ligaments, tendons, all that's like wrist, elbow, knee, hip. PRP is great. PRP is great for that stuff. So,
all right, everyone. Well, thanks again, and hope to see you soon.
Appreciate it.